to the Concepcion Channel podcast.
Hello everyone and welcome to the Concepcion Channel podcast. It's brought to you by the Being Fertile program and Yin Still Reproductive Wellness. I am your host, Spence, PENTLAND, and today I'm really excited to be here and be able to speak with our special guest, Kim Vopni. Welcome.
Thank you very much.
She's going to help us better understand vaginas. Is that accurate?
That would be okay. Well, yeah. I mean, kind of where the vagina lives, I guess, might be a better.
Okay, and okay, and admittedly, I often will go into a bit of an introduction in it, particularly in an area of expertise that I might have some. But like we said right before we hit the red button for record. We're going to be candid today. My profession talks a lot about poop and periods, and you talk a lot about vagina health, and we're gonna really try to relate, what Kim knows to fertility and healthy pregnancy. And so thank you so much for being on the show. Just a little bit of housekeeping before I get you to introduce yourself. But if you haven't already done so, at the bottom, if you're on beingfertileprogram.com, at the bottom, subscribe to our podcast so you can be notified when new ones come out. You can also on our YouTube channel, Concepcion channel, Apple iTunes podcast, leave a review if you like it. That would be great. And of course on our Yin Still Reproductive Wellness Facebook page. So without further ado, welcome, Kim. Thank you so much. Can you give people a bit of a background and maybe your story, where you came from and how you got to be where you're at today?
Yeah, for sure. I'd be happy to share. Really my story began with grade 6 sex education class, where they showed a video of childbirth, and it wasn't probably the best thing to be showing a group of young children and giving them an idea of what birth was supposed to be like. So I had this fear. I thought that's something that I'm just not interested in doing. And as I grew up, and I still had a sort of a fascination and a curiosity about birth, because what I saw, I knew happened to many, many women, and including my mother. So I would ask questions with my mom, and she was very open and shared her stories. And at the time when she gave birth, it was very common to have episiotomies, and it was just routine standard practice. So that was her experience. She ended up, as she aged, she did have some challenges with her bladder. So she was having leakage. She always had a tummy she wasn't happy with. She had chronic back pain. So all of these things started to point to me that birth was not friendly. Pregnancy and birth weren't friendly to the body. And it was, I really led an active lifestyle and I wanted to continue. So that was going to interfere with my activity level. So I wasn't going to be doing that. And that was kind of what started and really contributed to me now being very actively involved, having given birth myself and being very active in the community to promote pregnancy, birth, and wellness. And so what happened was, as I got married and I decided I did want to have a family, I watched my sister-in-law give birth. And I'm incredibly grateful for that experience, because it really probably was the turning point for me, where I said, you know what, I want and I can do this. And I know it doesn't have to be the same experience as my mom. And so I remember walking into my sister-in-law used midwives at a hospital, and we were waiting outside in the hall until the point where she said, okay, yes, you can come in. And so we came in at what I now know is really the worst time we could have possibly come in when a woman is birthing. But anyway, we did, it didn't inhibit her by any means. But I remember walking in and seeing my sister-in-law in a side-lying position and being attended to by her midwives. And in my head, I remember saying, oh my God, that's a big vagina. Like it was shocking to me. My niece hadn't been born yet, but she was starting to crown, and it was absolutely incredible. And watching my niece being born really was a transformative moment for me. And the next day, I remember asking my sister-in-law if everything was falling out of her, because I said I saw how big everything was, and she said no, actually it actually feels, there's a bit of change, but it doesn't feel like what I think it would feel like.
Okay.
And so that sort of inspired me and said, okay, well, what did she do? She used midwives. She was in a side-lying position. She used perineal massage. So the following year, I became pregnant, and I was determined to do everything I possibly could to have, again, that story that was different from my mom's. And I used midwives, and I looked at birth positioning, and I was very focused on the pelvic floor, because really that was my biggest sticking point. I really wanted to understand how I could ideally have an intact perineum, how I could avoid incontinence, how I could avoid prolapse. And when I was speaking with my midwives, they told me about a product called the Epino, which is a biofeedback device for preparing the pelvic floor for birth. And with my background in fitness, the product really is about strengthening and stretching and connecting with muscle function, really. Okay. So from a fitness background, it made a lot of sense to me. Mm-hmm. And I purchased one and used it. And again, I was in a sideline position myself. I used midwives. I did the Epino training. I feel like I was fairly well versed. So I had many things working in my favor. Birth is very dynamic. And just because you use one birth position or one product, it's not going to guarantee that you won't have any tearing or what have you. But I had a very positive experience. And compared to the stories of my friends, I felt like I had done some things or knew some things that I thought more people should know about. Right. And so I became a distributor for that product, the Epino product. And really that was, again, kind of my intention was never to start a business. It was just to start telling other women, and I would maybe make a few extra dollars. Right. And along the way, I started telling people about that link between fitness and why we should be using fitness to prepare our bodies for pregnancy and birth. Right. And so it just started to evolve organically, and it has become my career and my business, and I love it. And so that's kind of really, it was my mom's experience using that Epino product for myself, and then wanting to tell other women about the importance of preventive and restorative pelvic health, so that we don't have to accept and think we need to live with pads just because we've had children.
Right. So the comparison between your mom and your sister-in-law, it was, right?
Yeah.
Was stark, and that really sparked curiosity in you as
absolutely
why.
Yeah. So, and it was the media does a really good job at showing us that you have to be on your back, and it's going to be screaming, and people are going to have you hold your breath. And like, we have an image of how you think you're supposed to have a baby. And so when I saw my sister-in-law, I thought you always had to be on your back, because that's all I had ever been shown or heard of. Right. So it really opened my eyes, and yes, completely different. And I'm incredibly grateful that I did have that experience, because again, it switched my perspective and then put me on a different path.
Right. Yeah. I would postulate that most women today, the first birth that they see is their own.
Yes.
And that's a big difference from how things maybe were back in more village and tighter community times, before it was more of a medicalized condition or put into hospitals.
Yes. Yeah. I think that's very true. It's, we don't have the village, and we are very much in a busy super mom, I've got this mentality. So we don't have guidance as we're growing up. And then if we have experienced our own birth, that is oftentimes the first time. Right. And then we also don't have the village to support us on the other side as well. And so really we have to kind of build that tribe ourselves. And oftentimes women don't know that they even should, or who should be part of that tribe. Right. And yeah, for sure.
Well, it's interesting how, the re-rise of midwifery, at least I can speak to North America, because that's where we're both from, and that's in the last, couple decades even. And even the switches that I talk to medical colleagues, and the difference in enrollment today to how it was even not that long ago of male to female ratios into obstetrics and gynecology is very few male, so I think that village is kind of rebuilding itself, maybe in a modern sense or something.
Yes. Yeah. I absolutely think that movement or that shift is happening. And I certainly have seen that. Yeah. Yeah. So my first pregnancy, my oldest son is almost 14. So, 14, 15 years ago, I only heard of the word doula through a friend of mine. So it's a term I had never even heard. I had heard of midwives. I'd heard of midwives before my sister-in-law, but my perception of what a midwife was not at all what they truly are.
Got it.
So I think there is definitely a rise that in the birth professional world, midwifery is becoming much more accepted, I guess. Doulas are common, absolutely. Doulas are much more common. More people are familiar with those words. So I think that the shift is absolutely happening thankfully. Yeah.
Yeah. I mean, I think it's pretty accepted, at least in British Columbia, where I'm from, where midwifery care is covered under the Medical Services Plan. Thank you, Canada. But unless there's high risk, or a woman would feel more comfortable with their family doctor or an obstetrician, then midwifery is kind of a mainstream choice for women these days, which is great. So you are you want women to honor that the pelvic floor. I'm going to try and hone in on your specialty, right? I know it's your Vagina Coach, but pelvic floor and how. So because most of our listeners will be hopefully in this position of being healthy for pregnancy and a successful birth and recovery postpartum, but most of our listeners or viewers are trying to get pregnant or struggling to achieve that goal. What advice or what role does the pelvic floor health play in optimizing reproductive health, maybe period, or health overall, or fertility? Yeah.
Yeah, for sure. I'll just say one thing before, in terms of the name Vagina Coach, I for many years I actually was known as the fitness doula because I was the personal trainer and combined it with birth, and because I was working with women, many of whom had children 20, 30 years ago, who didn't know the word doula. And because it was kind of broadening through fertility, pregnancy, and beyond, I chose a different name. But pelvic floor still is a term that is not as known to people, but pretty much everybody knows vagina, and at least it hones in on the fact that I'm talking about female reproductive health, basically. So that was kind of the intention behind that. But
awareness.
Yeah, exactly.
That's perfect.
And so my passion really is the pelvic floor as a whole. So the pelvic floor is a group of muscles, and they're in layers. It's interwoven with nerves, and it has a huge blood supply. The pelvic floor is responsible for support to the spine and pelvis, helping us maintain our continence. And being able to really make decisions about pee, poo, or fart. A role in our sexual health. I'm missing one here. Spinal support. Oh, and organ support as well. So we have our bladder, our uterus, our rectum, and they play a role in helping keep those organs up as well. And it's a part of the body that we sort of take for granted. We don't. It should be working without us really having to think about it. Right. Things in life, so accidents, movement, lack of movement, injury, surgery, pregnancy, birth, all sorts of things can contribute to the pelvic floor and its ability to be something we don't have to think about, or something that, oh my gosh, it's the only thing we think about, because now when something is not working as it should, it affects so many aspects of our life. Right. And from a fertility perspective, it's a place of power, but it's also a place of tension. It can be the pelvic floor muscles, again, from all those reasons I said, oftentimes the way we hold our body, or the stress we have in our life, or potentially other influences that may have interfered with the function of our pelvic floor. Right. It can also interfere with the ability to conceive. And if we can optimize our function, so if we can have better connection, better awareness, less tension, less, I guess, more space to allow and kind of welcome that conception to happen,
right.
then that's really where we see the most gains. So in collaboration with professionals like yourself, pelvic health physiotherapy, I think, is a really incredibly underused women's health resource that women don't even know about, that really could play such a huge role in terms of contributing to conception or improving the likelihood of it. So it really comes down to kind of the tension and the function. So
it's a message I give often. Conception is about reception or being open, and that, to relax. A message I give myself is to relax my sphincter, and that would be pelvic floor, I guess. Yeah. But okay, so that area, I guess tense muscles down there could inhibit proper movement of the smooth muscle, like the uterus, which needs to do that to build a lining, and the ovaries to have openness to produce quality
blood
follicles.
Flow, circulation, everything, like absolutely. And the term, as you said, like relax your sphincter. There's even just right now, as you're listening, where is your tongue and what are your teeth doing? Yeah. So if your tongue is on the roof of your mouth and your teeth are closed, that's a common that people don't even recognize they're doing. And the pelvis and the jaw are very intimately connected. And when the jaw is tense, the pelvis is also tense. So when we're living in this busy world where, we have so many things and priorities and we're stressed out, we often hold a lot of tension in our jaw, which also it translates into tension in our pelvis, which we want to, once you are pregnant, we want to translate that into birth as well. You need to be able to relax, to allow things to dilate, to receive things, or to have that circulation, to have the movement that contributes to that flow throughout our entire body. Places of tension become stagnant. Okay.
I have a question just came to mind. Do you have any theories as to endometriosis? One of the theories behind how endometrial tissue from the uterus can flow, possibly retrograde into the abdomen in various parts, and then travel to various parts of the body, is prominent in a lot of circles still. Do you feel like a tension down there could somehow be contributing to that?
You know what? I think I've never thought of it that way, but yes, I think that potentially it could. So when there is tension or stagnation, perhaps the tissues are looking for somewhere that's less stagnant or less, you know what I mean? Yeah. So I've never thought of that. And I wouldn't say I'm an expert on endometriosis per se, but it is certainly a condition that is very common. It's something that a lot of my clients deal with, that as well as adenomyosis. So yes, I think really stagnation in our tissues can contribute to so many things. So I can only guess that yes, having tension or lack of movement could certainly be a contributing factor.
Right. And period pain, do you know of any direct correlations to period pain and pelvic floor?
Yes. So many people who work on releasing tension and work on improving the function, the response, the normal response of our pelvic floor, which is a contraction and a relaxation through the day with our breath, experience less period pain, less premenstrual syndrome. So 100%, absolutely. It's very, very correlated. Tension, it's even in birth, the fear, tension, pain cycle, right? So in presence of in presence of tension, it will contribute to heightened pain as well. So working on, like a lot of what I work with women on infertility as well as in pregnancy as they're preparing for their birth is letting go, learning to yield, learning to surrender. A visual I have, I'm not sure if you're familiar with a plant called the Rose of Jericho. And it looks like it looks like a tightly bound tumbleweed when it's dry. And when you place it in just even like droplets of water, hardly any water at all, when you place it in there, it starts to open and kind of, it's almost like a little bit of an octopus. But what the philosophy behind it is, one, it's the blossoming, but also what is contributing to when it's just a tiny bit of water at the base, what contributes to the entire hydration of the plant is the movement. That is what's carrying the nutrients and the flow of everything around. So we need to be dynamic in our day-to-day practices to improve our chances for fertility and improve our pregnancies and improve our births and keep our tissues, keep the juices flowing through our body that contribute to better health overall.
Right. So that is where the fitness obviously comes in.
Yeah. So I've been in fitness for many, many years, and I've done everything from boot camp to OsteoFit right. and kind of everything in between. And when so after my first birth, actually it was after my second birth, and I started to become, I started to be teaching more and explaining things and bringing in the fitness piece to my pregnant clients. And I started there's a principle in fitness called the principle of specificity, meaning when you're training, you need to have an element of cross training, but really if you're training for a triathlon, you need to train in biking and swimming and running. If you're training for a marathon, you need to train with predominantly running. So in preparation for birth, we can't practice giving birth over and over, but we can practice for labor. And what should a dynamic labor look like, and how can we take those movements and mimic them in our exercise? So that's when I kind of started to bring in the philosophy of fitness to prepare for birth, which is a very physical, emotional, demanding exercise event, really. And then it became apparent on those open to conceiving. So as they're wanting to start a family, how can we take those same principles and improve the function of their body and their pelvic floor and their core to, again, make it receptive and allow that process to happen.
Right. Okay, so I'd like to dive a little bit into treatment here and techniques and exercises or whatever. But in my practice, the ideal for me would be someone walks through my door and says, I plan on getting pregnant or trying to get pregnant in a year. Let's get healthy. And I'm like, yes, that's great. That's great. Okay, fantastic. Great choice. As far as pelvic floor physiotherapy is concerned, you said most people have no idea that it even exists until they've had, their postpartum, or there's incontinence, or there's an issue, pelvic pain maybe. So, and then they go to it and because they've had no exposure to it, some of it can be, a little bit unique or different, and it's scary, and I'd love to destigmatize some of that with you. But as far as, and we'll go through the different techniques and treatments, but is for someone trying to conceive, would going to a pelvic floor physiotherapist, beforehand, that ideal client that I just talked about coming before, is there benefit there to trying to?
Absolutely.
Yeah. Okay.
100%. Yes.
And what would you do? Like, what kinds of things would actually happen? Like, can you explain some of the recommendations and treatments?
Yeah. I apologize. I'm on spring break, so I don't have my vulva puppet and my pelvis model with me to demonstrate, but I'll do my best with my hands. So a pelvic floor physiotherapist is a physiotherapist who has additional training in the pelvic floor. Okay. And they treat men and women, but this conversation is specifically about women. So what happens in a pelvic floor physiotherapy assessment is many of them really are starting out as any other physio or body practitioner would look at. They're looking at alignment. They're looking at muscle function within the pelvis per se. How is the core functioning? How is everything lined up? Okay. And then the internal piece is typically it's done lying down to start out with, and many practitioners will actually assess in a standing position, which I highly recommend, and I'll get to that in a moment. But they will use gloved fingers, and they will be looking at the external genitalia. They'll palpate around. They will look at visually, what does the tissue look like? Is there anything concerning there? Okay. They will spread apart the labia, and they will visually look, and then they will take it's a small amount of lubricant, and they'll typically insert one finger and then two, if it allows, into the introitus. And what they're feeling for is tension. So first of all, can they insert a finger? Okay. Can they insert the second one? And they would be feeling then for the balance of tension, essentially, between the two sides. So is it a balanced field? Is there a balanced grip, so to speak? Right. And then they will look at the position of the organs. So are the bladder, uterus, and rectum in their ideal position? And they may often ask either for a slight bear down or a cough to see what happens when pressure, intra-abdominal pressure, is increased. Okay. And they will assess around the entire opening for that balance and tension. And then they'll ask for a Kegel or a pelvic floor contraction. So can the person contract, like squeeze the fingers, but also lift them? Okay. And then can they let that go? So from all the things I was talking about earlier with regards to letting go of tension, the inability to insert one or two fingers can be a first sign of tension being held. Okay. Oftentimes, the inability to contract and lift properly can actually be too much tension, because just as if I have my bicep flexed here and I need to flex it even more, I don't have much more to give because it's already flexed. Whereas if it's in a nice resting length, I have full capacity to contract, lift, and then let go. Does that make sense?
Yeah, sure.
So they're assessing to see if there is too much tone or hypertonicity, or maybe there might be too little tone. Maybe that it's too lax. And just like a muscle that's too tight can't generate enough force, nor can a muscle that's too lax. Sure. So it's an incredible piece of information that we often have never, it's actually sometimes astounding to me when women come in. I had a woman the other day who has given birth twice, vaginal birth twice. She has no connection, understanding of the pelvic floor, Kegels, nothing. She just has not been told or has not built that awareness, because we aren't. There's, aside from, oh, you should do your Kegels, that's really the only information that women may ever hear about the pelvic floor. Right. And so it's a huge opportunity to learn about a part of our body that we may have been completely disconnected from for many, many years, for different reasons too. But women come out of there and think, oh my gosh, I had no idea about this, or I had no, and they really are enlightened. So it's a little bit, some people go in, they're thinking, I'm not sure, what am I doing? But it really truly is an incredibly valuable piece of care.
Educational, big time. I'm visualizing, from my standpoint of fertility, and I'm like, that has to affect maybe sex, maybe enjoyment of sex, maybe even the production of cervical fluid, which is necessary for the sperm to move, everything. The movement of the uterus to move the sperm along and create a lining, and then the fallopian tubes to move the egg to the sperm.
Yep, everything you've said.
So much. Okay, wow.
Yeah, and even like positioning of organs. So some people, the position of the uterus may not be optimized. And maybe is that because of how they hold their pelvis, or is that because they were in a car accident 5 years ago? Or is that because they maybe had an abdominal surgery at some point, and maybe there's some scar tissue from an abdominal surgery that is contributing to pull on one of the organs? Like, there's so many, it's such an amazing, so many things can influence it. And pelvic floor physio is really such an essential, underused piece, and can really open the doors, so to speak, for women looking to conceive.
Yeah, no kidding. Okay, because you're right. I mean, and I'm so glad you're on the show and we're having this conversation, because even to me, it's eye-opening. That's why I said I want to let you introduce yourself, because it's really truly connecting for me too. I'm always looking for resources that obviously would help the women and couples that are coming to see me to conceive, sooner and carry that pregnancy to term. Because then, I mean, these same things that they're doing would also help probably maintain a pregnancy.
Yeah, absolutely.
Which is another step, which is recurrent loss. And is there anything that you feel that maybe the pelvic floor plays a role in that? That one, I have to think on that one a little bit more. I know that there's a lot of other factors that can play a role. Totally. I would say yes, potentially, but I can't say. I'm not well versed enough to say that one. Yeah. Sorry, I'm digging. You've really got me thinking a lot here. And for me, the underpinning message now is, even for my patients, is going to be added to my initial dialogue is, have you had a pelvic floor assessment? I mean, and I also, would send to a chiropractor that looks at the pelvis, and the alignment of the lower spine. And because that could also be pulling, and then
100%.
Maybe the tension of the pelvic floor, all contributing to just an environment that's like our jaw, grinding of our jaw and not optimal, right? I love that correlation. And, I just would like to pause for a moment to get everyone to relax their jaw and sphincter.
Yes, absolutely. Yeah. So let your tongue fall from the roof of your mouth. Allow your teeth to rest away from one another. And then as you take a breath in, imagine your vulva like that rose of Jericho that is opening and blossoming. Okay. That's what should happen. Whenever we take an inhalation, we should have the capability, we should have the opportunity, the pelvic floor should have the opportunity to allow that breath to come in and expand in our pelvic floor, but also in our abdomen. And women especially, I don't mean to pinpoint women, but women typically are the most likely to do this. They suck their abdomen in all day.
Okay.
And they don't want they want their tummy to look flat, or they think that they're engaging their core. They were told that that's how they work the core all day long, but that it doesn't allow full expansion of the breath or full expansion of then the corresponding expansion of the pelvic floor. So that contributes to tension patterns as well. So allow the tension to fall from your jaw, take an inhalation into your ribs, allow your belly to be soft and expand, and then allow that to also blossom your vulva.
Yeah, okay, blossom the vulva. Blossom the prostate, I'm trying to think. But okay, so now that there's been that assessment, and there are some concerns or room for improvement or preventative measures, what do some of those treatments look like that the physiotherapist would actually employ themselves, and recommendations for activity or exercise or self-care that they would send a patient home with? So maybe, people today, I like your breathing and that blossoming. That's a great tool that people could use for stress, for anything. But can you highlight or expand on that?
Yeah, for sure. So if the physio found that maybe there was more tension on one side, for instance, or maybe because of a car accident or previous surgery, there was some scar tissue and adhesions, they would then use manual therapy techniques similar to almost massage therapy. Now it's not massage therapy for your pelvic floor. I don't want to equate those two together, but essentially they would work at releasing the adhesions that could be contributing to the imbalance in the pelvic floor contraction. Okay. And then give you that teaching with the breath that what should be happening is kind of that inhale and release, and then exhale, and that's when the contraction should happen. Right. And that should naturally happen throughout our day with our breath. So there would be a teaching on that. They would probably teach you the Kegel, so how to do that contraction, that lift and letting go. And I know I use a bunch of different cues, and physios will do that. They have the benefit of actually having their fingers assessing the function. I don't do internal work, so I rely on other sources. But what cues, what visualization would work for that person to enable them to get a better contraction and a letting go? Right. Okay. So there would be a teaching there. And then the the pelvic floor, when we think of Kegels, if we've been told to do Kegels, we think either we've been told to do them at every red light, so we're sitting in our car, or some people will lie down on their bed and do it. And it's either place is not completely, it's not 100% terrible, but it's not the most ideal place to do them. But also it's a static exercise. Right. And we are and should be more, but we're dynamic beings. We need to move, and we need our pelvic floor to be responsive to that movement. So we need to make sure that we can contract and relax our pelvic floor as we move. Okay. So a lot of what I do is take women through movements that allows them to bring that connection with their breath and pelvic floor into a bridge, into a squat, into a lunge, pick up laundry baskets, car seats, whatever it is. Daily activities, and foster that connection. So the physios really work on that internal manual therapy piece. Okay. There, even if there is no scar tissue, there could be tension held for some reason, a rotation in the pelvis maybe, or many, many reasons. So they work on that piece, and then some of them will do a little bit of early movement, and then ideally there are practitioners and fitness professionals who have an understanding of the movement that can support better pelvic health. So, and from a fertility perspective, it really is a lot about, again, that it's the connection, building that awareness, and then undoing those tension patterns around the hips, the pelvis, the core, the abdomen gripping. Can we let that go and rebuild that internal strength so you don't feel like you have to be gripping to feel strong through the day?
Okay. It's such a crazy part of our body. I can't see, here, but I mean, in Chinese medicine, we call it the lower jiao, or the, kind of between the belly button and the upper thigh, what goes on in there, and that tension. And, there's some traditions that really regard that as an emotional center of our body. And I would imagine that there's accepted connections to emotions and the pelvic floor. 100%. Incredibly, a huge amount of emotion in various muscles, in our pelvic floor as well. There's a lot of, depending on a person's past, there can be a lot of shame or taboo or embarrassment, right? And that can also contribute to those holding patterns as well. So it's really about it's connecting with our feminine energy and our power, and releasing unnecessarily held tension that is interfering with our ability to enjoy sex, our ability to conceive, our ability to birth well. Big stuff.
Yeah, big stuff.
Orgasm, maybe. I just a quick thought. In what comes up for me, and from my experience in my practice, is the diagnosis of, or the lack of diagnosis, but diagnosis of unexplained infertility. Mm-hmm. And just in my experience and a lot of my colleagues, it's typically a diagnostic seen in women a little bit younger in their reproductive years, that we'd see maybe say around 30 versus with respect to 40. And that being maybe a time in a woman's life where the wisdom of surrendering to life, or I don't know, I postulate a lot of things, but maybe contributing because nothing else is showing up. My first thought is, wow, you've busted your butt your whole life and been told if you work hard, you will accomplish anything you want, and that's the messaging till when you're 30. Guaranteed.
Totally.
And so I'm postulating that the pelvic floor could be playing such a role with these women.
Yeah, I truly believe that it is something that, so we applaud the government for covering midwifery. I would love to see pelvic floor physiotherapy be standard of care, if not, kind of in our general healthcare, but at least from fertility and postpartum, at the very, very least. It should be standard of care, really, really should. It could contribute to better opportunities to conceive, better pregnancies, better births, better recoveries, less chance of incontinence, less chance of all of the things that women think are normal because they've had children. It really, to me, is such a missing link for so many women. And if we had the awareness about it and the openness, and it just became kind of like going to the dentist every year. We go for our checkup for our teeth. We go for a checkup of our pelvic floor. It's a part of the body that we can see our external genitalia, but we can't see all that's happening and working in that interwoven pelvis. All of that opportunity and strength and confidence and power is in there, but we aren't ever told how to find it or express it. And it's often held tightly because of many different other emotions or influences. So, if it was introduced at a younger age, it would be amazing. It really would. Yeah.
Not just that childbirth video, a lot more, right? I mean,
exactly.
It still is absolutely crazy in my mind that, health is not a standard educational class in our high schools. Anyway,
totally
reproductive, digestive. I mean, it's crazy. Anyway, I love, I can see it with pelvic pain too, and periods and childbirth and sex and all, ability to conceive, all these things.
Even pooping. So we were talking about pooping.
Yeah. It's just
constipation. Like learning how to position your pelvis and letting go of tension is such a huge piece with constipation. And if women had the understanding of that, oh my gosh, we would poop so much better.
Right. Yeah. The very related function. I mean, all smooth muscle down there trying to, and okay. So, I mean, fantastic. I want to sum it up as, cause we can relate to the word stress, and it may be as simple as we're just a place that we're holding a whole lot of stress, especially if it's an emotional center. It's that simple.
Yes. Yeah. Okay. Yeah. It's absolutely. It is an unknown place of stored tension and emotion. And we have so much opportunity there to, we really do.
So I just to keep in respect with your time. I mean, where can people find, physiotherapists that work with this, or people like yourself, or, I'll get your details and stuff, and your details will be in the show notes and all over the place. But just in general, if someone has some coverage for physio, or, it's like, do they just Google it in their city, or is there associations or?
Yeah. So, in Canada, where we are, I have a listing of physiotherapists across Canada on my site.
Okay, cool.
One thing I want to say is many people feel that they're supposed to go see a doctor first and get a referral to a physio. So unless your benefits plan requires you to do that, you do not need a referral to see a pelvic floor physio. You can just make an appointment and go. And I'm actually trying to expand my list to around the world, but as of now, it's predominantly Canada. Right. You can also just Google pelvic floor physiotherapy and your city or your province or what have you,
right?
And find people that way. We have the Canadian Physiotherapy Association in Canada. We have the American Physical Therapy Association, and it's apta.org in the United States. Okay. And they're called physical therapists, so pelvic floor physical therapist, or women's health physical therapist is another term that you might hear.
In the U.S.?
In the U.S., yeah. Okay. So we say physiotherapy, they say physical therapy. Okay. Australia has a huge network of pelvic health physiotherapists. And so really, if you are outside of Canada, Google pelvic floor physiotherapy or physical therapy in your city, and or visit apta.org, and you can search that way. Right. You do want to make sure, though, that when you're calling to book your appointment, you want to double check that the person whose profile you've read, maybe they say, fertility or pregnancy or postpartum or whatever it is, pelvic health, you want to make sure that they are trained internally, because there are other therapists who work in that realm who don't do the internal assessment. Right. So just double check that they are licensed to do internal therapy. Okay. So that would be the best way to find those those practitioners.
Okay. And great. Well, you've changed my thoughts and idea like I said, I will be recommending almost anyone, especially I rarely see women come in for help with their fertility that aren't stressed due to that, if at the very least. So it will be something that I'm adding to my, recommendations for women, no doubt about it. Yeah, that's fantastic. And this podcast, hopefully, if you're watching this, share it. I mean, this is such a great message. I'm excited about it. We live in a crazy world, and the stress, the stress that's out there today is so, there's so much emotion, and this could be such a huge contributing factor to, increased cesarean births, which are fine, but I'm just saying, as well as, difficulty with conception and so many of the other things we've talked about. So, so is there anything else you want to add that you're sitting there going, I need to get this in, or, okay, for now?
No, good? I think we got it. Yeah. I think Awesome. We've covered everything. So thank you.
Thank you so much. Before we go though, can you let everyone know where they can find you? Obviously we'll put it in the show notes, but if someone's somehow listening to this on Apple iTunes, or they can't find it, or where should they go to find more resources, and you in particular, and what services do you offer?
So you can find me at vaginacoach.com. Okay. And I'm probably most active on Instagram, where my handle is Vagina Coach, a little bit on Facebook as well. And what I do, I work one-on-one with women. I work online coaching, as well as I do in-person coaching in Port Moody, BC, to Rocky Point Wellness, and all that information is online there. And I have a lot of free resources on my YouTube channel and video section on my site. Okay. And then I also have a second business. So once you've been successful with conception and you've become pregnant, we cover the postpartum recovery, the preparation as well, but that's belliesinc.com.
Bellies Inc.
Bellies Inc. Bellies Inc.com. And so really my philosophy is about helping women prepare for pregnancy, prepare for birth, recover intentionally and very deliberately, and embracing pelvic health for life, because it's something it's not a quick fix. It's something we need to pay attention to through all of our life stages. And when we have the awareness early on, it really can, I've said this term a couple times, but it really can open the doors to so much more, life, to so much more vitality in our life stages. So,
Just learning to release tension everywhere, surrender to life a bit. My goodness, what a more pleasurable time on this planet, right? And its health benefits we've gone through.
Totally, exactly.
Well, thank you so much. I mean, I love what you're doing, and this message. I will definitely do what I can to help spread it. I do want to talk about. Maybe sometime, I'm not sure if you're the Vagina Coach. I don't know. Maybe you can point me to a resource for men, because the health of our prostates are if you look into our futures, all of our futures almost is pretty dismal. And I wonder how much of that is pelvic floor tension.
Yes, absolutely. And pelvic floor physiotherapists absolutely help with that as well. So yes, we have definitely focused on the female pelvis today, but men, you have a pelvis, you have a pelvic floor as well. And same things, same tension, same non-optimal holding patterns contribute to challenges for men as well.
Even ejaculation, prostate, urination, which 70% of us are, or I don't even know the stats anymore, are destined to not pee very well. But anyway,
that's another time.
I digress. But I would love to touch on it more, because it takes two to get pregnant, and I would love that too, since I'm a guy. But anyway, thank you so much for taking some time out of your vacation in Palm Springs. Enjoy the weather, and hopefully when you come back to Canada, it's a little warmer.
Yeah, hopefully.
Yeah. Okay. We'll have all those resources in the show notes. Go check out Kim, and thanks again for everybody for watching or listening, and we'll see you again soon.
Thanks, Spence.